Welcome to the inaugural series of Diversity MBA Media, Engaging Men in Leadership. We're so excited to introduce to you Andreas Gonzalez, the Chief Diversity Officer and Vice President of Froedtert Health, located in Wisconsin. So I'm excited to be able to conduct this first interview with Andreas. So Andreas, just, if you don't mind sharing a little bit with us about, your background, where you grew up, and what inspired you and kind of set you on your career path.
Sure. Well, first of all, Pam, thank you so much for the invitation. I'm always honored and probably more importantly, humbled that people think that I can be a leader that people should be maybe imitating or following, right? Or maybe reaching out to. So certainly delighted to be here this morning. So thank you. And I want to also thank Diversity MBA for the opportunity, first of all. Yeah, so let me tell you a little bit about my background. So I was born and raised until the age of 13 in the beautiful island of Puerto Rico. So I'm from the Caribbean, but my mother always had the thought, because she grew up actually in the States for a number of years, actually formative years, to always bring us back to the United States. She always talked about kind of achieving that American dream. And so back in the 80s, the island was going through, an economic downturn, and there were some things happening also in our community. I come from a very humble background, and our community was going through a lot of transformation, and not a good one, by the way. And so we unfortunately experienced a number of things that impacted our lives profoundly. And so my mother decided that those few things that occurred in that particular, in a sequence, if you will, prompted her to say, this is the time when we're going to actually leave the island. And so we ended up leaving the island, and we landed in Cleveland, Ohio. So Cleveland became our home. So I'm a Midwesterner by those standards. And so I did all of my high school in Cleveland. Actually, I went to Cleveland Public Schools. I was actually in probably one of the toughest and roughest areas of the city. Our school was actually the first school that had metal detectors. There was a lot of gang violence at the time, and I think not only in Cleveland, but throughout the United States. And so, it was a difficult transition, but certainly I would not change it for the world. It really transformed my thinking, my landscape, and my ability to look at things through a different lens. And one of those things was coming to a different country where Spanish was not the main language, which is my native language. And I found myself having to interpret for my mom everywhere we went, right, including healthcare. And that was probably one of the toughest experiences and eye-opening experiences that I had, because I remember, several times where mom, would pull me out of school, right, or I wouldn't go to school right away in the morning because I was her interpreter, right? Back then, we didn't have the same standards and compliance mandates that we do today, thanks God. But back then, that wasn't the case. So you relied on whomever you could bring in to those clinical rooms or encounters, right? So I became one of mom's interpreters, and that created an opportunity for me to understand through that lens the difficulty, right, of someone and being able to communicate effectively with their physician and having to do it through their children. And there were some painful things that my mom had to share with me and disclose that I know probably she would have never wanted to do that, but she was forced to, right, if she wanted to get care. And so that really was the catalytic, I think, episode or set of episodes that allowed me to see that healthcare could be a pathway for me, a career pathway in the future, and why we needed to actually probably go into that field. And I think it really shaped my brother and my lens, right, around the importance of not only getting an education, which my mother always stressed at home, but more importantly, go into the healthcare field so we can actually hopefully enhance it in a manner where, right, we will not put patients like my mother in that situation ever again.
Yeah, so that is so incredible. I mean, you truly had, familial experience to help direct and inspire you. And you're talking about in the 80s, but the reality is today, a lot of our young professionals, both men and women, are dealing with the transition from, tough communities to career path, uh, facing barriers and being able to, still stay inspired. So when you started out in your career, while you recognized that, okay, I want to maybe get into the healthcare industry, share with us, your career path development stories and perhaps one or two, barriers that you were able to overcome in that. And please feel free to bring any parallels to what's going on today, because I think your story is really incredible around that.
Well, appreciate that. Thanks for the kind words there, Pam. Yeah, I'll tell you, those experiences really shaped and profoundly impacted me, right? In a great way, because it gave me kind of what I call the call to action to go into the field. And so, and for my brother, for example, that translated into becoming a physician. He's the physician in the family. And so I think that that's the beauty of it, right? So there's always a little bit of a silver lining at the end of the day, but certainly it was actually something that really impacted us and shaped our thinking and our career pathways. I think to your question here, what I would say about my career is that I started in the not-for-profit field. I was fortunate enough to have great mentors along the way. That was the one thing that my mother knew that we needed in our lives. And so she was very resourceful in terms of finding out which organizations, right, could help us. And there was actually one particular organization in our community called Esperanza, which translates to hope. And they provided academic, tutoring and mentorship. And actually, it was through the mentoring program there that I met my mentor. Actually, he's still my mentor today. So it's been a long life mentorship relationship, and I'm indebted to this individual. His name is Jose Feliciano, like the artist. He's an attorney by training, someone who never forgot about his roots, where he came from, but always had in his heart and in his mind a sense of urgency about creating equity and making sure that our community was included in Cleveland in all aspects, right? So economically, in terms of schools and healthcare. And so he's been certainly a phenomenal leader, transformative leader in the Cleveland area. And so that opportunity of working alongside with him under his tutelage, learning from him, he actually developed my business acumen, my skill sets, gave me a number of stretch assignments that at the time I didn't understand what that meant, but I didn't want to hear it at times, right? And he would come in and it would be harsh about providing brutal feedback. And I would say, I don't want to hear that. And for a week or two, I wouldn't actually call him back. And he would say, that's your loss. I'm sure you're going to come back. And I did. So today, actually, interestingly enough, earlier this week, he called me asking for some advice, right? So it's really neat that things now, right, the tables have turned. And now I'm actually in a position where he's coming in, right, seeking some advice because he trusts my judgment. He trusts my thinking, my strategic thinking around some of those efforts that continue to impact our Latino community in the Cleveland area. But I say all that to say that he was the one who opened some of those doors. And early on, he connected me with a number of not-for-profit. And that's where I ended up actually getting, cutting my teeth originally. I ended up in the smaller not-for-profit community-based agency world. And I was fortunate enough to transition into one that was actually addressing substance abuse from a prevention, intervention, and treatment services in a culturally and linguistically relevant manner, not only for Cleveland, but for the entire state of Ohio. And so that really opened my eyes even more about, right, the need to have culturally competent curriculums, right, and how to cater, right, to communities that also were challenged from a language perspective, right, language preference perspective. And so that really led for me to become much more curious. I ended up getting my master's in the field. I'm a clinical counselor by background and school counselor by background as well. I actually held both certifications and licenses at one point. And certainly it wouldn't be good now providing neither of those type of counseling services, but at one point I did, and it was wonderful. And so, and you can still use some of those skill sets and competencies even in the work that I do today, which is really the neat thing in terms of being able to navigate, right, and help others to understand the importance of cultural competence and inclusive leadership, and why we need to actually meet communities right where they're at. So that a lot of that training and experience I gained in the smaller not-for-profit, and it was, after 10 years serving in that organization and 5 of them at the helm, I was able to actually run that organization for a number of years because my mentor, was influential and certainly came alongside to continue to develop me, right, and position me for success. And then I transitioned quickly to a workforce development organization after 10 years there. Did that for about 2.5 years, and it was there where we landed a really nice Robert Johnson Foundation grant to do some innovative career pathways in our community. And that's what really then provided the opportunity to partner with both the county hospital there, Metro Health Medical Center, and also the Cleveland Clinic, because they, had bookends hospitals within our community. And in the partnership with the Cleveland Clinic is that I learned and got to know a number of key leaders, which really then led to open that door, right, about career pathways within a true healthcare system. And while I was, against it originally, the leader that I connected with, which actually happened to be of Hispanic Latino background or Latinx background, who had worked for Jack Welch at GE, said, "Hey, I'm not going to give up on you, kid. There's something about that I like, and I would love to bring you into the clinic." So he did. And after almost a year of being persistent and obviously not taking no for an answer, and I joined the Cleveland Clinic, and the rest is history. I mean, that really gave me an opportunity to grow up in HR within healthcare. And then, he instituted the GE model where, you would get stretch assignments and you would go to other parts of the business. And one of my stretch assignments after a few years in HR and continued to climb into leadership roles was the ability to actually start our Office of Diversity and Inclusion. So it was actually really great.
There. I want to just say something. Have you pause for 1 second and say this? Because you said some really strong things that I want to make sure folks pick up. You talked about persistence, mentorship, the impact of volunteering within the community, and even working in nonprofit environments. And a lot of times folks don't give that much value, but you were able to shape how that really helped you go into the next level. So yeah, now help us understand. And also when you share with us, Andreas, about the work that you're doing now, what's kind of most impactful for you? What do you find within this work that is giving you the most passion?
Yeah, and energy every day, right, to get up from bed and show up at work. Absolutely. Well, let me, to your point there about mentorship and persistence and the ability to pay it forward, right, in your own community. Those are things, great lessons learned for me. And it's actually what has also shaped my thinking here along the way, and certainly here at Froedtert, for all of our BRG members and leaders especially. Pam, one of the things that we do is we encourage them to get involved in the community, get involved with community-based organizations, right? It's a great way of showing up, right? Providing your time, your talents right, and paying it forward in the community. And there's a lot of, skill sets and competencies, and also your network gets expanded by virtue of serving in the community. And so those are actually, great skill sets and experiences and networking opportunities that you will probably not be afforded if you stayed right in kind of in your insular world, right, in many ways. And so you're absolutely right. Those are things that we have built into our model, and it's actually what's in it for each one of our BRG leaders and members if they get involved in the efforts, right? And it could also position them for promotional opportunities over time. So you're absolutely right about some of those things that I have learned along the way and that really have propelled me to the next level. So, so you're absolutely right, about that piece as well. And so I think, in terms of the work, what keeps me energized here is I think, Froedtert and the Medical College has been an exemplary employer of choice for our community, but certainly for me as a leader, as a diverse leader coming in. Our CEO leads the way. She's an inclusive leader. She walks the talk, and I know it sounds cliche, but it's very true. Kathy Jacobson walks the talk, and every single commitment that she's made, she has delivered on. And one of the last ones, which is really, I think, what gives me a lot of energy, is this past year, right, with the pandemic or the triple crisis, right, of the pandemic and the economic impact, and also the community unrest, certainly that was actually, in many ways, right, the outcry of our community based on the death of many individuals, right, diverse individuals, African American individuals, including George Floyd, which became catalytic for our nation. We decided that it was important for us to take a stand for things and against things. And what I appreciate about Froedtert is that Kathy, early on, we had a discussion, actually, even before, as the pandemic was starting to loom, right, and coming our way, and we could see that, tidal wave, right, approaching us here. We said, we have to take a bold step here and be courageous. And what I love about Kathy is that we drafted what now has become an anti-racism pledge, where she said, hey, not only are we going to stand against racism and call it a public health crisis, but we're not going to stop at words. We're going to actually be committed in terms of actions, right? So we're going to be actionable on this. We're going to be accountable around this, and we're going to be transparent to be able to share with people where we stand, right, along the way in terms of our journey and our efforts moving forward. So, as we enter the pandemic, we had wrapped up a very comprehensive and really impactful 5-year strategic plan and efforts, and it really gave birth or led to the creation of what we call now Eradicating Racism and Enhancing Health Equity, which is our 3-year plan. And so now we have, that pledge into posters in all of our facilities. And I will tell you, I get tickled every day when I get from a community member or someone who I know within my network that will take a selfie, right? Or or sends me a text with the banner and say, hey, I'm at this particular facility and I'm actually really inspired and I want to, and I'm thankful. So thank you for taking this step, right? Because I know that your office is the one who has been leading this effort. But at the end of the day, right, it's a team effort. It's about collaboration. And in my case, the way that I lead is by inspiring and influencing others, right? That's the best work that we can do. And that's what we have done here. And so we have developed a very comprehensive plan that not only addresses diversity, inclusion, that's where we double down on. That's our foundation, but it's really predicated on how are we creating greater health equity, and now how are we addressing systemic racism, right, as a health network, knowing the history that health and healthcare, right, healthcare systems have played in America. And so we're owning our own here in southeastern Wisconsin. And what we have said is, hey, we're not going to shy away from having a true discussion about what we've done, but more importantly, here's what we're committed to, and we want you to come alongside and co-create those efforts, and then also, as importantly, hold us accountable to it.
Congratulations to you for that. And we have our last couple minutes. Today with defund the police and the injustices that exist with DACA and as well as all of the other ethnic issues that's going on. What advice would you give a young, not just Latina, but specifically a young Latina male that is hearing you, knowing that you overcame the odds, that may think their odds are different than what's happened, but to keep that next generation moving forward? What advice basically would you have for the next generation as we close this great conversation?
Yeah, Pam, great question, loaded question as well. So here's what I will say. I am not an Einstein. I'm not the brightest kid of the bunch, but certainly I have applied myself, right? And I tend to be pretty methodical in my approach and make sure that I do my best work, right? And so I try to learn whatever I'm tackling. I try to learn as much as I can about the subject or the field, right, to do well. And that's what I've done in terms of the work that I lead here. Of diversity, inclusion, equity, and anti-racism. And so what I would say to any young person out here, especially, Latinx males or diverse males for that matter, is, make sure that you don't take the opportunities for granted. Number one, there's been people that fought hard along the way that have been the trailblazers before us, right, that have paved the way. And so while it might look easy for us, someone paid with sweat and equity and maybe with their own blood and lost their lives for that fight, right? And it reminds me, right, of the great work of one of the people that I admire the most, which is Dr. Reverend Martin Luther King Jr. In his fight, right, for equity and social justice in this country. And so for me, I don't take that for granted. And so you shouldn't take it for granted, but also seize the moment. When these opportunities come along the way, seize the moment. I think that sometimes we get intimidated that we might not have the skill sets that we might not, be equipped, right, with all the competencies or skill sets, or hey, I have an accent when I speak. I do have an accent, and I'm proud of my accent because I do not see that as a deficit. I see that certainly as an added value, that I speak multiple languages, that I'm bilingual, that I'm bicultural, that I can navigate multiple worlds, right, and look at the intersectionality of those worlds, right, and bring that to the table, right, as added value in terms of who I am as a leader, as a person. And I would say also take advantage of mentorship opportunities, and if you don't have a mentor, seek one. That to me has been the game changer. And I think that anyone who has had a mentor in their lives can probably attest to the difference and the impact that it has profoundly made in their lives. So those would be some of the lessons learned and maybe tips that I would provide to any young person listening to the podcast this morning.
So thank you so very much, Andreas Gonzalez, Chief Diversity Officer of Froedtert Health and Medical Center. We're so excited to have had this conversation, and we look forward to the next. Thank you again.
Thanks for having me, Pam.